Power Form, Module 5. There are key components necessary to facilitate efficient order entry. Upon admission, the nurse caring for the patient is expected to enter the patient's height, weight, dosing weight, allergies, home medications, and preferred pharmacy into PowerChart. These can be entered using the designated sections within the intake form. The patient's preferred pharmacy can also be accessed via the icon located in the toolbar. One of the advantages to CPOE is real-time alerts related to allergies. For this reason, it is critical that patient allergies be documented upon admission. Allergy information carries over from previous encounters here at Shore. Therefore, any previously documented allergies should be reviewed with the patient and updated appropriately with each encounter. The Allergies section of the intake form allows you to add an allergy, modify existing allergies, and mark the allergy list as reviewed. No known medication allergies should be documented if appropriate for your patient. Height, weight, and dosing weight are completed in the vital signs section of the intake form. On admission, weight and dosing weight would be the same. However, there may be a point during the patient's hospital stay that the provider places a dosing weight update order. He may want one of 3 options designated in his order. He may want you to weigh the patient and record that weight. He may want you to document a specific weight for the patient, or he may request that you document the last charted weight in kilograms. Your documentation would be completed on the dosing weight form in the ad hoc folder. Dosing weight is a critical piece in weight-based medication orders. Documentation of home medications is required before the provider can complete his admission medication reconciliation. Click on the Med List section of the intake form. Then click on Document Medication by History. To add a medication, click on the blue plus sign. Once a medication has been added, it is important to document patient compliance in taking that med, including last dose date and time. Once the medication history is completed, a green check mark will appear in the reconciliation status box. Note that the patient's preferred pharmacy documentation can be accessed directly from the Document Medication by History screen. The patient's preferred pharmacy is documented by clicking on the patient pharmacy icon in the toolbar. Once a patient's preferred pharmacy has been added to PowerChart, the provider will be able to send prescriptions electronically to that pharmacy. Let's click on the patient preferred pharmacy icon. If the patient does not have a specific pharmacy, click the box that says No Preferred Pharmacy and select a reason from the drop-down. If the patient has a preferred pharmacy, use the Search tab in the Preferred Pharmacy screen. Type in the pharmacy name, city, state, and zip code if available. Then click Search. A list of pharmacies will display on the right-hand side. Highlight the appropriate pharmacy, right-click, and select Add to Patient Preferred. The Patient Preferred tab allows you to maintain the preferred pharmacy list. If more than one pharmacy is listed, you can denote one as a default pharmacy by right-clicking and selecting Default. Notice the default pharmacy is displayed in bold font. To remove a pharmacy, right-click and select Remove. In addition to height, weight, dosing weight, allergies, home medications, and patient's preferred pharmacy, the order entry details form should be completed on admission and once a shift thereafter. It must also be completed should there be a change in patient status impacting order details. Here's an example. Your patient's labs were previously drawn by lab, therefore nurse collect in the order entry details form was documented no. The physician inserts a central line and checks may use IV line for labs. A new form should then be completed designating nurse collect as yes. The data from this important form automatically populates the orders to provide better communication between caregivers. This concludes Module 5.